Good afternoon, everyone. I am Nancy Polsinelli, Interim CAO for the Region of Peel. I'm joined today by Jessica Hopkins, our Region's Medical Officer of Health, and the mayors of our partner municipalities, Mayor Bonnie Crombie, City of Mississauga, Mayor Alan Thompson, Town of Caledon, and Councillor Fortini, acting on behalf of Mayor Patrick Brown as acting mayor. We're here to share information about COVID-19. We want the community to know that the region and its partners are working together to support and protect the health of the people within our region, more than 1.4 million people. The region is ensuring we are positioned to respond to the potential for transmission within our community. Yesterday, we informed Council that we have fully activated the Regional Emergency Operations Center. This does not mean that the Region of Peel has declared a state of emergency. We have not. This is about focusing resources effectively in both mitigating the transmission of COVID-19 while operating the services that people depend on. To do this, we are working very closely with the region and its partner communities, led by the mayors with us today. Dr. Hopkins will now provide an update on the status of COVID-19 in our community. Dr. Hopkins?
Thank you. Good afternoon. With the announcement of the COVID-19 pandemic by the World Health Organization, increasing cases in Ontario, particularly related to travel, and unprecedented measures to protect the health of Ontarians, at this time, Peel Public Health is recommending additional preventive public health measures to reduce the spread in the community. In consultation with local healthcare institutions and education leaders, Peel Public Health is recommending the closure of child care centers, before and after school programs, and March break camps effective March 14th through April 5th, coinciding with the school closure dates. The Chief Medical Officer of Health for Ontario has recommended the immediate suspension of all large events and public gatherings of over 250 people. For events and public gatherings less than 250 people, Peel Public Health is directing organizers to assess the risk. Further guidance is available on our website. The Chief Medical Officer of Health for Ontario is further advising residents to avoid all non-essential travel outside of Canada. In addition, Peel Public Health is recommending anyone that has traveled anywhere outside of Canada to self-monitor for symptoms including fever, cough, and difficulty breathing, and avoid attending locations where it is difficult to distance yourself from others, such as schools, workplaces, and mass gatherings, for 14 days after returning to Canada. At this time, this means that for those traveling for March break and hoping to attend school or work on April 6th in Peel, you should return to Canada by March 23rd. Anyone who has traveled outside of Canada and experiences symptoms should self-isolate until they have been free of symptoms for a full 24 hours. Our emergency departments and assessment centers are currently very busy, so I'd like to reiterate the advice to the community. If you have no symptoms of respiratory illness and have not been given different direction by public health, you do not need to call public health and you should not seek testing for COVID-19. If you have mild symptoms of respiratory illness for which you would not normally seek medical care, please stay home until you've been symptom-free for at least 24 hours. It's important for workers to follow the direction of their employer's occupational health and safety, and this is especially true for our healthcare workers. If you have moderate to severe symptoms of respiratory illness and require medical care, please make sure that your healthcare provider is aware that you have traveled to an affected area or been in close contact with someone with COVID-19 so that they can take appropriate infection prevention and control precautions. There are currently 6 cases of COVID-19 in Peel. All of the Peel cases traveled to affected areas or had close contact with a case of COVID-19, and all are in self-isolation and recovering at home. The risk in Peel continues to remain low, and there are no known cases of community transmission in Peel. These recommendations are being made to further enhance prevention measures to keep our community safe and healthy.